Oh,
You
man.
right there, Gimpy?
Knee pain. I just went for a walk. Knee pain actually is pretty common, particularly people over 50. We've got this video made for you.
Now, not all knee pain is created the same, so we're going to go over 5 different options of things you can try at home, test them all out, and just see which one works best for you.
Yeah, and we're actually going to take a trip down memory lane, go 4 years back. Bob and I are doing some really nice exercises, and then we're going to come back and do a couple additional exercises that we came up with recently so that we're all up to
I'm
date.
just going to hang out here because time travel makes me sick.
There you go. Okay, here we go. We're going back in time. Oh, things are starting to shake. Okay, beat me up, Scotty.
Bob and Brad, the 2 most famous physical therapists on the internet.
If you have
100%.
pain while you're walking, it's getting very uncomfortable, first thing you need to do is take the pressure off it by using a cane.
Yep. Or a walking stick.
Or a walking stick. If the right knee hurts, you're going to have the stick or the cane in the left hand, and you're going to walk with that. And if your pain's at an 8/10 walking without the cane, when you use a cane, it's probably going to go down to like a 2 or a
Right.
3.
And it's not permanent.
Right. It's just takes the pressure off it, allows the knee pain and the inflammation to settle down.
Once it calms down, you can get rid of the cane.
Right. Well, at the same time, while you're using the cane, you're going to do these exercises as well. So
That will help.
the first one we're going to do is check your range of motion. We need to look particularly knee extension. I'll cover the extension first.
Sure.
So if this is your sore knee, and this is your good knee, and this one straightens out all the way, and this one, and you check it next to each other, you can see there's an obvious gap, or even a little one. You want to get that knee to fully extend or straighten. So you can do it like Bob and I, sitting on the edge of a chair works nice.
Pressure on, pressure off.
Yep.
Push above the knee.
Yep. Don't get real aggressive if it's sharp pain. Be gentle with it. This may take a few days. Do it 3 times a day, 10 repetitions. Now you can rotate your toe or the leg this way and then try to straighten it.
Might feel better.
Yep. And then you can go this direction. And
Again, might feel better.
do which one gives you the best range or feels the best, okay? Now, you also want to check knee flexion. Probably not quite as important as extension with walking, but it's nice to stretch it this way. And you can just do it like this. Slouch in the chair. It's one time we allow slouching. And stretch that knee.
Again, compare the 2 knees.
Yep.
One might feel tighter.
Yes, exactly. And get them so they're equal. All right. Okay, once you get your knee loosened up, the range of motion is looking good. The quadricep muscle is more than likely weak, and we need to strengthen that.
Most important muscle.
Yes, Bob's got the first option we recommend.
You put a pillow underneath the knee, and you're going to push down, press the back of the knee into the bed.
Right. The pillow.
Hold into the bed or pillow.
Yep. And you can do this
Hold for 10 seconds.
sitting on a couch. You can do it lying in bed. But like Bob says, hold for 10 seconds, 10 repetitions. Now, this is the little secret I was talking to about, that when you're walking, we want to get that quadricep to be strong, well, upright.
And stable.
Yes. So you do need to have something stretchy, a stretch band. Most of the time they have these little clips or carabiners. Wrap it around the leg of a table. Whoa, that was a smooth transition to that port. Yeah,
you
nice.
changed.
Oh, yeah, my shirt came with. I can't believe it. Yeah, same exercise and all. It's amazing how that time travel works. Yeah, so this is what I was doing. It's really nice to get that strengthening quad with the weight bearing, just like I had described. Same thing now. Now we want to continue on. I mentioned we had a couple new options that we didn't have back then to help that knee pain. What's the first one, Mike?
First is working on your infra or Yeah, I can't even speak today.
Here, let me help you out.
Your
I'll show.
superior tendon or your infratendon.
Yeah.
Anyway, your patella tendon here, what happens is you have your quads and they all conform into the patella tendon and your kneecap and they insert down here on your tibial tuberosity. And sometimes people are tender above the kneecap and other times people are tender below the kneecap. So we're going to massage in that area. And Brad, you can show with hands first. I'm just
Sure.
going to mess around with this.
Yeah, so above the patella or the kneecap, if you've got pain, you're going to actually relax it. If you can't move your kneecap, you're too tight in the quadriceps. Watch this. See my kneecaps bouncing around because my quads are relaxed. Then you know you got good relaxed muscles there. And you're going to use your fingertips or your thumbs and work cross friction massage. This is a technique that's been around for years and it works well. And that can really get in there. You get on that sore spot. If it hurts a little bit at first, that can be okay. However, if you do this and after 30 seconds, it's a pretty hard stop on that time. If it continues to hurt after 30 seconds, that means it's too early. Put a cold pack on it, rest it for another day or two, then come back and do your cross friction massage. As after 30 seconds, it feels better, kind of like a numbish feeling. Then you can continue to do it for a couple, 3 minutes or until your fingers get sore. One thing you can do that as an alternative to a manual massage, so your fingers don't get sore and actually works better, is a massage gun, which are very popular nowadays.
Yeah, so you can work the supraspinatus area, which was I was trying to say, or your we're just making up tendon names. Anyway, go above that's your shoulder anyway. We're going to go above the knee here, and we're going to go below the knee here, so you can just work that tendon in the area that's problematic.
Infrapatellar tendon down there.
Suprapatellar. There we go. I'm on shoulders right now. Anyway, what you could do is just massage in this area. It might be too aggressive to go directly on it like this for some people, so sometimes going sideways is a good option, and then below the knee the same thing. And what you can do is just make sure you have a nice soft head. So this is a foam round head. An air head like this would work as well too, specifically on that knee region. Whatever massage gun you have hopefully has these. You just don't want something too aggressive and pointy like this hard plastic one.
I really like the round head so you can go sideways so you get that cross friction massage there or there. And, you know, it's much easier close to that kneecap. So I highly promote the round one. The airhead one works pretty good too. But
remember the patella tendon.
There you go. Yeah. If you're going sideways with the airhead one, it just doesn't have near the surface area to do a good job. So
yeah. And then the last tip number 5, is actually looking at your walking pattern or your mechanics. So in order to do this, what we normally have people do is take off your shoes. You can go barefoot in your socks or slippers in your house. If you happen to have 0-drop shoes, then you can wear shoes. But what you're going to do is look at your walking pattern. A lot of people, when they walk around, specifically in shoes, they walk, their foot goes in front of them, their heel strikes, and they're getting a lot of impact forces going from their ankle into their knee and up into their hip as well. And then you start to engage the muscles as you go over your foot and back behind you. So what we want to do instead is just take a smaller step and not emphasize the heel striking. Just kind of land with the forefoot and notice my body is underneath my foot. My foot is not in front of me. What this does is puts the impact forces through your muscles, into your quads and your glutes where they should be going instead of directly into your joint. So what you can try at home is walk around how you normally would, place your hands on your buttock, see how much your glutes are engaging, and then you can try the very opposite of going up on your tippy toes and seeing how much your glutes are engaging. If there's a big difference, then definitely look at your walking mechanics. If you don't notice a whole lot, then you're probably already walking with pretty good mechanics.
Yeah, I was just I was looking at some videos of Rick Olderman's, and one of the verbal cues that I hadn't heard yet was when you're doing the forefoot of the soft knee walking, where you're not heel striking, you're doing here, a visualization of that your knee stays in front of your foot. So if you think about your knee staying in front of your foot, that can be something that will be helpful. With this changing your walking, we've had people that walk, heel strike, and they say, well, and with pain, and then say, well, do the forefoot walking with the slightly bent knee without the heel touching, and their eyes open up and they say, oh, pain isn't there anymore when I'm walking. So can be a real immediate pain relief.
Yeah, so just take your time. It's going to feel a little odd, especially when you try to walk at a quicker pace. So it just takes however many years old you are walking to unlearn those habits. So just give it time. It does get easier. I personally switched a handful of years ago, and now it feels odd to heel strike. So just take some time.
You better believe it. We want to go to another video if you want to get some more information. Or if you have knee pain for a long period of time, this could be the answer. Why your knee pain isn't improving. We go through some one of the many. What am I saying?
Many options of different things you can try.
There you go.
We're both word searching today.
Yeah.
I'm going to go review my knee anatomy and then my shoulder anatomy to not get them confused again and talk about the supraspinatus tendon.
So anyways, good luck with those knees. They can be very pain-free if you find the right trick.
Bob and Brad, the two most famous physical therapists on the internet.